In our study, funded by Versus Arthritis, we wanted to find out whether people living with persistent pain or rheumatoid arthritis were more likely to also live with other long-term conditions, and how this affected their overall health. Although we know that people with rheumatoid arthritis experience pain, we wanted to look at them separately from those people that live with other types of persistent pain to see if there were any differences in the impact on their overall health. How do we do this? We started by examining data from a large-scale biomedical database called UK Biobank. UK Biobank collects health information on over 500,000 people across the UK. Participants of UK Biobank answer questions about their health and lifestyle, and over time this is linked to further health data to examine how health changes or disease develops. Using this type of data lets us investigate risks and outcomes in large numbers of people so we are able to see patterns. What is a risk? The probability that an event or outcome will occur. What is an outcome? An event or measure that happens after measurements were first taken. In this case, after the time people entered the study when we looked at what health conditions they had. In Scotland, we also have a research study that tracks the health of people who have recently been diagnosed with rheumatoid arthritis. They are called the SERA cohort, so we looked at SERA too. What did we find? In UK Biobank, we found that over 200,000 participants reported persistent pain that had lasted at least 3 months. And 5,658 said they had rheumatoid arthritis. Living with several conditions is common. For those living with persistent pain, 2/3, 69%, also lived with at least one other long-term condition, and the number of additional conditions increased with the number of sites of pain a person reported. Of people living with rheumatoid arthritis, 2/3, 66% of SERA participants and 3/4 of UK Biobank participants lived with at least one other long-term condition. When we looked at the outcomes for people living with persistent pain or rheumatoid arthritis along with other long-term conditions, we found that those living with several health conditions had poorer outcomes when compared to those living with persistent pain or rheumatoid arthritis alone. They were more likely to stay in hospital for longer, more likely to have a cardiac event, and more likely to die earlier. It's important to remember that our study examined large numbers of people, so we see patterns. If you have persistent pain or rheumatoid arthritis and another condition, it doesn't mean that this will happen to you. Everybody experiences their conditions differently, depending on other parts of their life. Our research shows health professionals caring for people with persistent pain or rheumatoid arthritis and those who design healthcare services that living with other conditions alongside painful conditions is important. We want healthcare professionals to think about the whole person, to think about improvement in overall health when treating pain or rheumatoid arthritis, and to pay attention to other health conditions. To find out more about this research, please contact Dr. Barbara Nicol at barbara.nicol@glasgow.ac.uk at the University of Glasgow. Thanks to our funders, Versus Arthritis, and to all those who participated in UK Biobank, www.ukbiobank.ac.uk. Thanks also to the SERA participants.